Welcome to Business Horizons, the NBSO Lyon podcast where we dive into international entrepreneurship and explore the growing connections between the Netherlands and Southeast France. Today, we're talking with Anna Garrec, someone who really knows how to bridge the Dutch and the French healthcare innovation scenes. Anna is a managing director at Care Animations France, a digital health company helping patients access truthfully medical information through animated video. She has played a key role in introducing several Dutch healthcare innovations to France. So, welcome on board, Anna.
Thank you for having me.
Nice to meet you. So, can you walk us through how you moved from studying law to working in business and eventually found yourself in healthcare innovation?
So I started law studies, indeed, in Germany and in Paris. But I specialized in health, environment, and food. So from the get-go, I wanted to play a role in making life better for either people who are eating stuff or people who are getting treated or for the environment. That was my specialization already. And that was also my first job as a lawyer because I worked for a pharmaceutical company. And then I moved to Germany, worked for a food company. And then I moved to the Netherlands, and then I worked for a medical device company, and that was an amazing experience. The innovation of medical devices, the way you change doctors' lives, surgeons' lives, patients' lives. That was amazing, and I decided to stay in this area.
Okay. So what first attracted you into healthcare and medtech business?
That was definitely the innovation, the way you change things for the better, and also because it has a side of, making the world a better place because you cure people.
Can you share some practical lesson you learned from bringing Dutch healthcare innovation to France? Do you have any example, for example, of what you did? What did you work on? What kind of innovations did you bring to France and help Dutch company to bring to France?
So I can talk about Care Animations. It's a platform that is known in the Netherlands as Kijksluiter. It's the transformation into animated videos of content that is medical, so the leaflets for the medicines and instruction for use for medicines and also medical devices and some other instructions around treatment and medicines. And those videos are distributed by the healthcare professional to patients. And so the first step there has been to analyze what the Netherlands has been doing as for a business model and whether we could duplicate that for France. And of course, we could not. Also, what was the level of digitalization of the pharmacists in France, which was not the same as the stages in the Netherlands. So the first step has been to see with what we have, what can we take one-on-one and adapt and use immediately for France? What do we need to adapt? We even created a product for France. And then we had to redesign the whole distribution path because we don't have the same actors and the actors don't have the same weight.
Okay. As a French person, I've never heard of this product before. Is it already distributed into the health system in France?
Yes, you have nowadays approximately between 800 and 900 pharmacies that have that product and can distribute it to patients.
Okay. So how would you compare the Dutch and the French healthcare markets from your point of view?
There are differences. The first difference for as far as I'm talking about Care Animations is the level of digitalization of the pharmacies, as I was mentioning. The fact that in France you have the Sécurité Sociale and then you have the mutuelle, so you need to address two different kind of partners, while in the Netherlands the private insurance covers everything. So that makes it a bit more challenging for the French market, for instance. There's a huge weight in the pharmacy business of the syndicates in France, which, as far as I know, is not as strong in the Netherlands. Of course, it's a smaller country, so you also have less people to put at the table for talking. For instance, in France, we have 3 different syndicates for the pharmacists. So, while in some countries you have only one. So
once again, it takes time.
Yeah.
Do you need any partners to bring innovation from the Netherlands to France? Do you need local partners?
So again, depending on your product, you definitely need, if you are doing research or if you need to be in hospitals, then you will need to have supports of healthcare professionals inside hospitals. If you want to do, if you need to install a production area in France, you want to hire people, you want to produce something on the French ground, you want to do R&D, it will be easier because there you can, as soon as you create value on the French ground, immediately you can get subsidies and grants. So there you need to have a coordinator that helps you. And I know the Métropole in Lyon is doing that very well. You can also work with NBSO. And then the key in the end is to have someone who is very familiar with how the French healthcare system works and help you meet the right people depending on how, at what state you are with the development of your product.
Okay. So what other advices would you give to Dutch entrepreneurs getting ready to launch in France's healthcare sector?
Again, I don't think the advice is typical for Dutch people. But if you want to make a decision and have an idea, you should first come to France and visit. Congresses and conferences are usually a good opportunity to start talking to people with the help of someone who can introduce you to key stakeholders, and then that would help you design your business plan and your strategy. Second point would be to know from the get-go that you cannot copy-paste the marketing strategy you had in the Netherlands, most probably. So you need to be ready also to make that step that you want to adapt to another way of thinking, whether it's on B2B or B2C or B2B2C. And then to me, in the end, you need to have somebody who is truly dedicated, even if it's not full-time. But I would truly advise that you have a French-speaking person really dedicated to your project that can help you go through the first deals.
Okay. What are the main cultural differences that you have noticed when it comes to building trust and negotiating partnership in France versus the Netherlands?
So here, it also depends on how far you are with your product. I've worked a lot with startups. So it goes with the mindset that you want to do everything fast, and sometimes you think it will be easier than what it is, which is also a good source of energy. And the Dutch are also famous for having trust in themselves, probably more than the French. So they are very positive and very happy and enthusiastic. And so what I've witnessed is that the plans are not always realistic. So it's very common among startups. We are belonging to the Latin area of Europe. But be on time at the meetings. We are not late. The French, it's not true. And don't take it too easy.
Okay. So, but was it very easy to install these innovations in France? What works the best for the French health industry to adopt the Dutch innovations?
Well, I would want to say if the product is good and you can rely on the quick reaction and you can rely also on the words that are said, then you have good chances. Of course, you can have French competition, and then there's always a struggle because I have witnessed some French project, of course, get the priority over Dutch projects who would want to be established in France. So that happens. But if your product is good, you have your chances.
And how do you manage the need for agility common in startups while also you have to navigate into the realities of healthcare regulations in France, which are very complicated?
Yes, it's complicated for big groups. It's also complicated for startups. It's the same for HR, human resources. It's not because as soon as you have a company in France, whether you have 500 people in it or only one or two, you are submitted to French labor law. It's exactly the same for regulations. And there you need to choose well, maybe address priorities, but you will not be able to bypass the administration you have in France, the regulations. So maybe you need to select. Maybe there's only one project that you can do at the same time. Or if you raise funds, you need to plan that budget well.
So for you, what big trends do you think will shape the future of healthcare and medtech in Europe?
Well, so definitely AI, digitalization. I would want to say it's already completely done, but it's not completely done. So we're still in the verge of doing and transforming it. I know we all want to do more in prevention and education. It's a long-term strategy, so everybody agrees, but sometimes it does not come through because it takes too much time to invest for prevention. But to me, it's really the future. And as we talk to areas, if you compare what happens in the news in the past 2 years in France and the global trends, we will need solutions for everything in regards to the silver economy or to aging, solutions for people staying at home, remote monitoring, and I know the Dutch are players there. Everything that is fighting brain diseases and cancer, we are still looking for help. Mental health is a big topic this year in France, and it's not going to be over at the end of the year. So on all those areas, there is room for innovation.
Yeah, and for the Dutch entrepreneurs, what are the most promising opportunities in this sector over the next years in France?
Yes, exactly those actually. So brain cancer, chronic diseases, diabetes, aging, seniors, and helping healthcare professionals doing their job better. So everything that can facilitate the life of nurses, of people working in elderly homes, all that will be welcome.
In France, our public health system is a bit of a mess nowadays. Is that the problem for the entrepreneurs who want to bring innovations to France?
Yeah, it is challenging. There is a big plan though for France 2030. With, if I remember well, 7 billion euros for investment in research. So the envelope is not empty. It has just started. So there is room.
And opportunities.
Opportunities, yes.
Okay, thank you. We have some kind of a tradition on the NBSO podcast. Our previous guest, Damien Giraud, from the Auvergne-Rhône-Alpes region, wanted to ask you, without knowing who you are, what do you think could improve the relationship between the Auvergne-Rhône-Alpes region and the Netherlands?
Well, here I want to be a bit tricky, but I would say a direct train. I know there is a direct train in the ski period from the Netherlands to the Alps. I'm not so sure we should still promote a ski vacation anyway, but if we could keep that line direct on a regular basis, I'm sure it would be already a good start.
Okay, but anyway, there are still a good train connection from the Netherlands to Lyon and the southeast area anyway.
Yeah, via Paris, yeah.
Yeah. And Anna, what question would you like to leave to our next guest?
So I would want to ask, what would be your ideas to organize a very big networking event between the Netherlands and Auvergne-Rhône-Alpes next year?
Okay, that could be a good question. Is there a specific region in France where Dutch entrepreneurs should target first to present their innovations?
So it's a good question because something I wanted to say. If part of your strategy, if you cannot afford going to whole France, the French healthcare system works a lot in the region division. So you could also decide, okay, I don't want to go for the whole France, but I want to target one region, and depending on my product and what I want to offer and where I need to have my contacts, I can go for one region or another. The Auvergne-Rhône-Alpes is actually a good region because historically, it's a center for research in medical sciences. The pharmaceutical companies are here too. You have a lot of researchers, lots of laboratoires. So that could be a good start. Les Hauts-de-France are also extremely pushy in relationships with the Netherlands. So, and it's also geographically, it's one of the first region you can reach. And then if you look at your specialization area, the good relays for healthcare are the clusters. You have, if I remember well, 8 clusters in France. Montpellier, Nantes, Paris, the north of France, Strasbourg, Lyon. So depending on what's your area, whether you work on cancer or a brain, or you want to develop medicines for, or you want to use the biotechs, or you want to use this, you want to work for the silver economy, you can actually reach out to that specific cluster and start from there.
Okay. Well, thank you, Anna. That was Anna Garrec, NBSO Southeast France health consultant. Thank you for giving us a closer look at how Dutch healthcare innovations are making their mark in France. And thank you for your insights that remind us that going international is about more than just a great technology. It's all about building the right partnerships, having patience, and understanding cultural differences. So if you enjoy this episode of Business Horizon, please subscribe and share it. So we'll be back soon with another guest. So thanks for tuning in.